Okay, Reese. Again, I'm sorry about the way that these are filmed. This time we actually have this now, so we'll be able to film for you much better once it's set up and ready to go. So in the meantime, I'm going to do the best I can with what we've got. So I'm going to have her hand this. I'm going to hand this to her so that I can show you what's going on. So she came in and she was clutching her back. Very visible back pain as she walks very slowly like this. She's complaining of lower back pain, some leg pain as well, and she seems to be over it, as if it's too much to handle. So I asked her a few questions. What's going on? She points out the pain. It's very high. She's not 6 or 7, sometimes 8 on the pain scale. When she bends over, she's very afraid to bend over. She is walking she's slowly going like this, and on her way back up, she's kind of almost walking herself back up into extension, into a neutral spine. So that's what's presenting. She has not had any other previous injuries. This is just residual onset of pain over time, and it has just gotten to the point where she couldn't take it anymore. So she came in after practice. So after some, I don't want to say excruciating, but just some exercise. Just exercise is what has elicited this pain to the extent that it is. Oh, I just realized the shirt that you're wearing. Classy.
I realized it as I yawned.
And sorry about that. Okay, so what I'll have her do, those are visuals. I've asked her, where's the pain? I've asked her about any previous injuries. I asked her what happened in practice. She said nothing, just I'm very sore. Very, very sore. I can barely walk. I had to stop practicing. Coach told me to come in after practice. This has been going on for a while now. She's had to take a few practices off. And that's about it. So I'll begin by palpating again. So go ahead and lay on your stomach. And put your sweatshirt up. Okay. So I'll begin with lower back palpations, starting generally high into the L3, L4, S1. Both sides. May trigger pain. Most likely will, because this is what she is complaining of. I will check her legs. Not so much pain on palpation here. So what I'll have her do is I'll have her roll over. And this would trigger some more history questions, of course, as I'm palpating. I can also ask questions. So she's very hopeless. She's very upset that she can't practice. She's very depressed. She doesn't feel like it's something that's ever going to end. She was very apprehensive as I'm palpating, very afraid that it might hurt. So next what I'll have her do is I will have her actually come here and stand up this time, instead of like in the first video where I had you sitting. So I'll ask you to bend forward, and what she would normally do here is very, very slowly, hands on her hip. You don't have to do this, I'm just explaining because it's just easier than trying to give you instructions. Asking her to stand back up. She would walk herself up her hips as I showed you in the beginning of the video. She's going to be very afraid to do this. I'll ask her to also lean backwards as well, and she's going to be very afraid to do this. And then to the sides, to the left and to the right. Of course, these are all eliciting pain. And I will also have her arms across her chest, rotate to the left and rotate to the right. Again, all of these are she's very apprehensive, very afraid to do these motions. So I'll go ahead and I'll have you sit down. This time, if it's not going to elicit too much pain, I can, again, I will support here as she crosses her arms and rotates towards me, pulling her in. And then again on the other side. Again, very afraid, and this is a very key finding here that I'm noticing that she's very apprehensive towards every movement. She's very, very sore after this practice, for whatever reason. So I'll have you come to the right. I don't see. I'll have you lean this like you're gonna do this. Okay. So I'm gonna try and hold this up here so you can see here, pulling her in like that, and then again on the other side, pulling her in, and then forward as well, and also backwards. Backwards, I guess I'll have you stand up for this one, and then forward, and then I hope you can see this, or I'm doing it for nothing. So I'll be supporting her here with one hand while pulling her. Oh my goodness. Yeah, you hold it. And then so pulling her into that motion as well. And then if we have gotten this far, depending on her pain, I could do resistive. So I'll have you cross your arms again and go ahead and rotate while I hold here as well. And then I would have her lean to the right. I'll have you stand up for this one too. And then as you, here, can you hold this? Okay, up. I don't even know if you could see the first one. We're gonna find out after I'm done filming. So I would support here as she rotates in. And then same on the other side. Hopefully that's good, go ahead. Okay. And then forward flexion. I would have her here, supporting her at the hip. And then also backwards, hand here, supporting her at the hip. Again, very apprehensive. So now what I'll have you do is, I'll open up your arms there. No, I mean just kind of, yeah. So I'll check L1, L2, L3, L4, S1, S2. I know you don't like your feet touched. And then I'm checking for, because of the generalized pain, I'm going to be checking all of them. So what I'll have you do is I'll have you pull up your hip, okay, and then extend the knee, and then pull your toe up, and then can you pull your big toe up like that? Okay, good, and then down, pull your knee in, and then I know there's nothing, I can't really get her back there. So she could be, it's so hard not to just assume which one it is, but it would most likely be L3, L4, S1 is what I'm looking at for lack of sensitivity to touch and movement. What I'll also do is I'll go through again and I will resist these motions. So go ahead. And then I would be stabilizing where my last hand was here as she pushes out. Stabilizing here and pulling, and then big toe, and then push down, and then pull in, and then at the hip, if I could. So again, excuse me, L3, L4, S1. So what I'll have her do is I'll have you lay on your back. We'll start with flexion this time. So go ahead and cross your arms. I'm gonna apply pressure to her feet here so that she can't. So come up to 45 degrees. Okay, and then go ahead and lay back. This would elicit some pain most likely. And then I'll have you roll on your left side. Yep, do you remember what we did last time? Yep, good. And then roll over. Okay, go ahead. Weak, but good.
Yeah, no.
And then go ahead and lay on your stomach this time. Okay, and then go ahead. Okay, you're cheating, I can see it, but good. So very apprehensive during these motions again. I'm gonna go ahead and scoot back, go back there. And then I'll have her do it again. So I'm gonna do the straight leg raise, as you should in almost everyone, just to rule it out. And these motions are going too good. So negative finding here. So now I've tested, I've palpated, I've asked history, I've palpated, I've assessed active, passive, and resistive range of motion if I can get through all of them. I've done manual muscle testing, I've checked dermatomes and myotomes, which I would also check reflexes. I don't have a hammer. On the knee, back of the Achilles tendon. The only thing that I haven't done during this exam is the grading scale, removing gravity, starting with a 3, working my way through, if necessary, removing gravity from the situation, or adding resistance. I haven't gone through that whole scale, which I would if I had an actual like a level of injury to go through. So since she's very apprehensive, she's very anxious, she's very hopeless and depressed about getting back into practice, I'm gonna diagnose her with generalized back pain. So first thing I'm gonna do is I'm gonna refer her to some sort of counselor, a psychiatrist, or a psychologist to assist with that. We're going to do some postural correctiveness, some mobility increases when the time comes, and some strength training as well once we get into recorrecting all of the motions. Originally, there's going to be a lot of rest in this situation for the sake of recovery. So it'll be a gradual process from rest to correctiveness to mobility to strength. I can't say that I would diagnose her with any medications. I would hope that nobody would put her on painkillers until absolutely necessary. The psychologist might, put her on some sort of antidepressant or anti-anxiety medicine, and we'll have to see. We'll have to go from there and work very slowly. Okay.